today, and I'm now very proud to hand you over to Katrine, who is one of the co-lead authors of the COVID-19 Fatigue Framework from WHO. So thank you so much, Katrine.
Hello, and thank you very much. I'm just going to share my presentation and introduce myself. So I'm Katrine Bach Habersaat, and I am acting team lead and regional advisor for behavioral and cultural insights at the WHO Regional Office for Europe. And as Hugh was saying, I developed the fatigue framework that we're going to talk about today, together with my colleague, Andrea. She's the beautiful young woman that you see here on the screen at the bottom. And we developed it together, obviously, with the input of a range of very many other people who provided input, including through reviewing it. And I even saw some names here of you. Some of you here today have reviewed the framework in the early phases. So thank you for that. And I do feel quite humble and grateful that this whole meeting is to discuss the framework. Obviously, it's always very gratifying when something that you've worked on is found to be useful by someone else. So thank you for that at the very beginning. But I was asked to talk a little bit about why we developed the framework and how. And so I'll just take you back to last year in September when we developed the framework. And this was the situation we saw in many countries. This is from one country. We saw that the number of people who were keeping themselves informed regularly about the pandemic was decreasing. People who were keeping up protective behaviors, the same. People who had high risk perceptions. We saw in many places the same, the percentage was decreasing. And countries at that stage, we really felt the pandemic had been going on for so long, and it's already a long time ago. But countries were reaching out to WHO and saying, what can we do? What can we do to address this fatigue or this frustration, this situation that we're seeing in our countries? And it wasn't a particularly easy question to answer, I'd have to say, because as we all know, this was a situation that we hadn't been in for 100 years. So there was no straightforward answer. So we reviewed relevant evidence in a number of areas. We looked at the behavioral insights data that we had access to. I showed you the example from one country before. We have worked together with a long range of countries in our region and supported them in collecting behavioral insights data throughout the pandemic to understand population behaviors and perceptions and well-being during the pandemic. And we looked at that data as well. And together we used that to develop this framework on reinvigorating the public to fight the pandemic or to prevent COVID-19. And in this framework, we decided to define pandemic fatigue as a completely natural reaction to what people were going through for a long time, and saying it expresses itself as distress, emergent demotivation to keep up protective behaviors and keeping yourself informed, and also perhaps feelings such as complacency, alienation, hopelessness. And we said it's something that evolves gradually over time and is affected not just by individual emotions or experiences and perceptions, but also very much by external factors, environmental factors like the cultural, social, structural and legislative environment. So that's what we decided. I think very fairly enough, we introduced this concept building or rooted in evidence as we could, but also very much in the situation as we experienced it at the time. And there were some scholars who questioned a little bit that notion of pandemic fatigue and saying, is this really the name? Is it fatigue? Is it something else? And is there strong evidence that this fatigue or this feeling of distress in itself leads to demotivation and in itself leads to a lower uptake of protective behaviors? And fairly enough, we did see at that time, and we still see that while people are fed up with this pandemic, the vast majority actually continue to adhere to regulations and recommendations, which is quite impressive. So that's a really interesting discussion, but perhaps a more academic one. And it's important to say that we did talk to these researchers who were from the London University College, and one thing they emphasized is that they found that the strategies that we proposed were very, very appropriate. So that's where we definitely agreed. And I think to explore this issue of whether pandemic fatigue really is a thing, and it exists, a group of researchers from Denmark and Germany then went along and looked at data that they'd collected weekly in the two countries throughout the pandemic to try and explore whether something that we might call fatigue really does exist. And they found that that there are actually two kinds of fatigue. One is information fatigue, so you're really fed up with hearing about COVID-19. And then there's the behavioral fatigue where you feel demotivated to fight COVID-19. And then interestingly enough, or importantly, they saw that these types of fatigue actually do drive non-adherence to the recommended practices. So already now we know more about pandemic fatigue than we did before, and I'm sure it's kind of one of those things that we will continue to explore also beyond the pandemic, and something that is quite interesting and may spill over even beyond crisis or pandemic situations. Anyway, that was a bit about the background. The framework itself includes 4 key strategies and 5 cross-cutting principles and 10 proposed actions, and that's actually what we're going through today. So I'm just going to flip through quite quickly the 4 strategies. The first one is about understanding people. So through these behavioral insight surveys, through focus groups or interviews or social media monitoring, whichever way we can try and understand better the barriers that people are facing, but also what motivates them, what drives them, and most importantly, using that insight to inform action, to translate the findings into policies. The second strategy is about engagement. I think we humans have a very essential fundamental need to feel in control of our own lives, and when that autonomy is threatened, demotivation is very often the result. And so any strategy to reinvigorate the public needs to involve engagement one way or the other. And there are many ways to engage, particularly at very low local levels. And I'm always using the example of my own 2 children, which I think they're 13 and 16. I think they're very responsible, but at no point during the last 14 months at their schools, when they have been back to school, have they been engaged in a discussion about how in our classroom or in our school would we like to protect each other, how would we like to keep our schools safe. And I think the kids could have come up with some really good suggestions, but it doesn't seem to be the norm. And I think that's just a micro example of something that potentially happens at all levels of our society, that we potentially haven't been good enough at asking people, what do you think and how would you like to adhere to recommended practices? Second strategy, it's built on the notion that the human mind is interesting, that if you ask somebody to do something they think is feasible and realistic, we're likely to do it. If we're asked to do something that we think is unrealistic, we're likely to not even try. So this draws on more of a harm reduction thinking, where if you have groups in your society where it's either unrealistic or maybe for other reasons undesirable, that they stay completely away from each other. And we have seen, particularly with young people, but also other population groups, that it may not be the best approach to just say, well, you can't do. Then there might be other ways of, maybe through engagement, but providing guidance and allowing people to somehow do what is important to them, live their lives, but guide them in doing so safely, and finding that balance, which of course is incredibly difficult, and sometimes the epidemiological situation prevents that. But it's one of the principles that you might consider. And then obviously we've all lost something in the past 14 months. Rituals like weddings or funerals, or birthdays that we couldn't attend. People have been sick, some people have lost dear ones. Some people have lost their income. And regardless of what that hardship is, it is something that we know that struggle is a driver for demotivation. So it is something that we need to acknowledge and, if at all possible, address. Even though it's difficult, and it also depends on what the options are in the different countries. I hear someone speaking in my, sorry about that. Anyway, the last slide is here. It's, I'm hearing someone.
Please could you mute yourselves if you're not speaking? Sorry.
Sorry, yes, you're right.
Don't worry about it, not a problem at all. No, the last slide is actually just about the 5 cross-cutting principles, about implementing all of the 4 strategies I've just mentioned in a spirit of transparency and predictability and fairness and consistency and coordination. Obviously not easy during a time of completely changing circumstances and very emotional reactions from everyone, and engagement of so many stakeholders. But the reason why we're emphasizing these 5 principles is that we know that these are the 5 drivers of trust. And obviously we can also see in our data that trust is just a critical factor for everything, for well-being, for uptake of protective behaviors, for everything that we want to achieve with this. So the five principles are really difficult, but they're also really, really important. That's it. Thank you.
Thank you so much, Katrine. It's really interesting to hear kind of, where this has come from and kind of some of the drivers behind that, and especially kind of, around the information fatigue and the behaviour fatigue as the 2 driving elements behind that as well.